All right, good morning, everybody. Thanks for joining us today. Super happy to introduce Dr. Linda Chaudron, who I found out last night is actually a Pittsburgh native, having been born at Magee Women's Hospital. Didn't spend much time after that in Pittsburgh, but we're really happy to have her here. She's currently Vice President and R.G. Bingyu Chair for Maine Health Department of Medical Education and Professor of Psychiatry at the Tufts University School of Medicine. She leads the Department of Medical Education, where she oversees a remarkably comprehensive educational portfolio. It includes undergraduate and graduate medical education, advanced practice provider education, continuing professional development, interprofessional education, and simulation. She joined Maine Health after more than 2 decades at the University of Rochester, where she served as a faculty member, senior leader, clinician in perinatal mental health, and accomplished researcher with more than 70 publications. Dr. Chaudron is nationally and internationally recognized as a dynamic speaker on women's health, leadership in academic medicine, equity and inclusion, and career transitions. I had the pleasure of watching her speak at the AAMC Women's Mid-Career Conference about 2 years ago, and knew at that time we had to bring her to Pittsburgh. Her own professional journey spanning clinical care, research, and executive leadership reflects thoughtful, value-driven career decisions. Today, she'll share those insights, navigating career decisions and transitions, a topic that touches all of us, regardless of where we are in our professional lives. Please join me in welcoming Dr. Linda Chaudron.
So Steelers or Pats? Not gonna say anything about that. I want to thank Dr. Freeling for being so gracious and inviting me. If you don't like what I say today, you can blame her, because I took a version. What she saw was a workshop, so you'll see this isn't the same kind of usual lecture. I also wanted to thank Dr. Spears, Dr. Saladino, and Dr. Dermody really for allowing me to be here, inviting me. And so I hope this is helpful to you all. And I know we have a lot of people online, and I'm not sure how interactive that part can be, but at least for those of you who are here, I hope you will be interactive. Nobody wants to just listen to me talk for forever. So I'm going to start with disclosures. I have no financial disclosures, but I did want to say that I do this as a workshop in many places, and I think that's just important to know for folks. So this is a simple approach because I think this is more of what is important to you. So I want to talk and identify, have you think about 3 reasons for changing a role or an organization. And when I say organization, it could be an internal organization, it could be department to department, department to university, department to medical center, and I'm going to talk about that in more detail. I want to talk about how to explore any career opportunity that comes your way, and some of the challenges and ways to overcome some of those challenges that we all get when we're kind of in this career path. How many are physicians in the room? Is everybody a physician? Are there psychologists, social workers, medical students? Okay, all right. So I'm used to speaking to multiple disciplines, but as physicians, you all knew what you had to do to go to med school. You all knew what you had to do to get into a residency, very linear, and then it becomes not so linear. And so that's where I want to talk about today, is the non-linear, how do I develop in my career without knowing I need to check X, Y, and Z box to get the role that I'm looking at. So nobody probably has a pen, but you probably have a phone. I want you just to either jot down or think in your brain where you are right now. What does your career look like? What does it feel like? And when I do this in a workshop, I have people literally draw it. But I'm in Maine. Life is calm, my career is blue skies, or not. But just at the moment, is it, just think about that. And if anybody wants to share, you can just yell it out. And
that some of it is steep and some of it is more easygoing. So you go on pieces of like a calm walk to places where you're enduring a little bit more to get to a steady state.
And that's in the moment even, right? That's not just your career path. That's in the moment, day to day. We have those calm days and those like not so calm days. Thank you. That's great. So then I want you to also think about how you got here. And for the medical students, was it as linear as I just described? For many people, it isn't. And what I want you to think about, and again, I have people literally draw this because I think it's important to get out of your brain because we are very academic and we think in words and into a picture. And think about your career path. How did you get to where you are? And you can start anywhere you want. I could start with McGee, being born here. That's not very useful. I could start with college. I could start with med school. And at different points in my career, I might start at a different space and then stop at where you are today. But what I really want you to think about is where are the influences? What made you decide to go to med school, to go to pediatrics, to go to your specialty, to come here? And the reason is we're going to talk a lot about, as Dr. Freeling said, I like to talk about value driven because we're going to look back at our histories and think about what got us to make these decisions because they're going to influence how you think about your future decisions. And while it may have felt linear, at any point, you had to make a decision. And my own decision way back when in college was I knew I wanted to go into psychology or psychiatry. Not a clue what that difference meant really. Did a little bit of talking to people, still didn't really understand it. And my decision to go to med school was I'll have more opportunities. That's all I knew. I think if I have an MD, I'll have more opportunities than I have a PhD. I don't know that that's true, but that was my 18-year-old, 19-year-old brain. And so I went pre-med and I ended up in med school. Would I do that now? I don't know. I think I would, but hopefully with more rationale behind it. But think about those decision-making points, the people who influenced you, and then what those trajectories are. And we are all very, you're not here if you weren't somebody who pushes forward. And so we think like the trajectory has to go like this. It does not, and it rarely does. So it does the ups and downs, it does this, it does that. So we're going to talk about that a little bit more today. So what does your career path look like? Sometimes it feels like you're going up a mountain. I think about it sometimes as jumping from stone to stone and just trying to keep my balance. Might be curvy. I like the labyrinth because I think sometimes it feels like that. And sometimes it's an arc. And sometimes it's a road. So just give yourself a second and just in your brain, visualize how you would describe your career path to date. And if you're willing, just scream out what vision pops in your head. The labyrinth? Yeah. All right. Okay. So the labyrinth is the one. Anybody else? What's the med student? Yeah. So it's a direct line because that 90 is whoa, right? But you come on and off of it. There are paths on, paths off. I love that. Except the food is terrible. All right. So keep that in mind as we kind of walk through today. So you may want to say to me, look, I don't care about thinking backwards. I want to think about forward. But I think looking backwards is really critical because it lends itself to our biases about what we think our future will be. If you had a really hard time or a really easy time, or you liked this or didn't like this, or had this experience when you interviewed somewhere, it's going to influence you whether you realize it or not. So when we talk about unconscious biases, this is just one of those, right? Your experiences give you a lens on what's available to you, what you want to do, how you get there. We all have lessons learned, some harder than others. And we need to look back on that. I think looking back really grounds us. What are your values? If you go back to why you went into medicine, what you wanted to get out of being in medicine, that will help you stay on your path to wherever you want to go in the future. And then when I put this talk together, which I had never done, and you'll see there's not a lot of research in this talk, there's just a lot of opinion in this talk. But I think when I look back, it reminds me that our pathways, our careers are long. And when you're in the moment, whether you're a med student, you're a resident, you're early career, it feels like you have to do everything at once. And you don't. You have a very long career. And that path can change many times in that career. And so that's helpful. There are varied paths. It can be really unpredictable. There can be go over there. Here's an option you never even thought about. And I'll talk about my own path and how that is. It can be really exciting. It can be really scary. It can be really irritating. And I think for me, looking back, most importantly, it helps me identify the people who have supported me along the way, or those interactions that I didn't know were going to turn into something very meaningful. So you heard I'm going to talk a little bit about my experiences, and most of them, so this is the linear path, right? This is the Route 90, high school, college, medical school, residency. Oh, had a baby June 30th of my third year of residency. And then had another one in my did a fellowship and had my son in my second year of my fellowship. That fellowship is one of those experiences. I knew I wanted to do women's mental health based on my experiences as a resident. And back then there were very, very few fellowships. There was one in San Francisco, one in Toronto, and one in Chicago. None of those places were going to work for my husband. And I was talking with Molly Carnes, who is a geriatrician in internal medicine at the VA, who had a Center for Excellence for Women's Health. And I just mentioned to her, I'm trying to figure out what to do. And she said, what do you want to do? I told her, and she said, you can come do my fellowship. I was like, okay, I'm a psychiatrist. I'm a perinatal psychiatrist. You're a geriatrician. You're in internal medicine. How is this going to work? The fellowship was designed to support individuals to do women's health research, which is what I wanted to do. And so she's like, most of it is you get your master's, you're doing research, you're learning all of this. And the clinical part, we can make you a consultant to the women's health clinic. That was my first, blow my mind that I didn't have to stay on this rigid path. And it was that one conversation that changed my career because I happened to reach out to her just to say. So lesson number one for me, reach out, ask people. You never, ever know what's out there that you don't know about. So after that, I did 2 years. I was offered a third year. And by then I had 2 children. I'm the primary breadwinner. It's like, I need a real job. So I started to look at places. I had gone to Rochester for medical school, had no intention of returning, not because I didn't like it, but it was like, did that. I interviewed a lot of places and I got recruited back there by the chair, who was my chair then for 17 years, and one of my most important mentors in my career, still is actually. And we decided to go back to Rochester, promised my husband 5 years. because he was from Rochester and he was like really excited. We're going somewhere new and whatever. I'm like, okay, we'll go back to Rochester for a few years. 22 years later, I was still there. So most of what I'm going to talk about, and I've thought a lot about, we talked about writing last night, writing an article about how to stay where you are. And I get bored every 4 or 5 years. So I had to find ways to grow and change in my organization. And so that's mostly what I'm going to talk about. And then I'll talk a little bit about how I ended up in Maine. But it was not linear in Rochester. It was great, but it wasn't linear by any means. So I'm going to stop there on that. I'll come back to it in a minute. But what I want to talk about is when you are looking at any opportunity, and whether that's internal, external, doesn't matter. This is a career opportunity. There's always a push and a pull. And if you are a resident, how many are residents, fellas? Right, there's a push, you end. You got to figure out what you're going to do next. And so you're looking at a job. Do I do another fellowship? Do I stay where I am? What do I want to do? Do I go part-time? Do I go full-time? What does this look like? It's a whole kind of another phase of your life where you're trying to figure things out. And there's a push and a pull no matter what when you're looking at a job. And when I say job, I may mean 10% or 20%. Think about it as a role, not necessarily I'm going to change a job. I'm thinking about new roles, and I'll talk about how I did that. But the push could be, it's the end of something. Your fellowship ends, your residency ends, med school ends, whatever it happens to be. It could be you're not satisfied anymore. It could be like me, I get bored. I've figured out that challenge, I need a new challenge. You might feel underappreciated. You might feel the work isn't meaningful. And this is where going back to your original values is so critical, because why are you doing what you want to do and what isn't feeling right anymore? And how much of that? Sometimes there's changes in leaders, there's changes in mentors, and it makes you rethink. And then there's the pull. Is there something exciting? Is it a new challenge? Does it have more flexibility? Do I have more influence, responsibility? Do I feel more respected, appreciated? Is it because of something with my health or my family's health that I need something different? Is it money? Is it family? Is it work-life balance? Is it location? I need to be closer to the place. One of the reasons that San Francisco was not going to work for me was my husband is an architect. And with all of the regulations and things in building around earthquakes, he would have had to have all kinds of other certifications, and it wouldn't have been easy for us just to drop in there. So that was something I had to take into account. And those are just things that are reality. And so when I talk about a push and a pull, there's always a push and a pull, no matter what. And you have to think about both sides of that. And sometimes we're just focused on this little piece of a push and not really thinking about all these other things. And that push may not be so big really in the greater scheme of things. So I encourage you to step back and look at this. And then there's a tipping point for people. So when you look at something new, start with your values. What are your needs? Then what are your wants? I think sometimes we go to our wants first. I'll speak for myself. And then you're like, do I really need that? And then weigh the pros and cons. And I've put in a little bit here about gender differences that comes from the literature, mostly because, first of all, you don't want to be biased. You don't want to assume this no matter what. But I think it's important to see the list of things that different people, and while this was done by gender, different people have different reasons for what they want and need. And I think that's really important because sometimes we think everybody just wants more money or more time, and that may not be it at all. They may want something more challenging, or they may want a role where they have more flexibility, or they may have a role where they're giving back more. So it's important to ask people, what do they need and what do they want? Whether you're the one recruiting or you're the one being recruited, you want those questions. So now I'm going to ask you just to pause and think about your own values. What do you want to get out of your work? And if you were going to look for a new position or a part of a position, or you wanted to change your current position to be something more fulfilling, what do you want from that? And so while you're thinking about that, I'm going to just show you mine. I am always about serving the underserved. And when I was in Rochester doing research and perinatal work, I was really working with urban low-income individuals. And now I'm in Maine and have learned a ton about the underserved in rural areas. And so my commitment, no matter where I am, that's number one. Number 2, 3, and 4 is integrity, honesty, and inclusivity. I want a place, no matter what the job is, that those are my values and they're going to be honored. What do I want to do? I want to improve the lives of patients and communities. I want to impact the future of medicine, and I want to support people's careers. If you'd asked me 10 years ago, 20 years ago, that is not what I would have wanted to get out of my work. I wanted to learn to be an expert clinician early in my career. I wanted to learn to be an educator. I wanted to learn to be an administrator. I wanted to learn to be a researcher. So these things change over the course of your career, which is why one of the things I always say is go back every 4 or 5 years and sit down and do this, because things change. And what would I want from a new position? I always want a strong, positive team. I don't want the naysayers. There's always a naysayer, but the culture of the team needs to be positive. I would really like always to work with a visionary, strategic, transparent leader. I want to be at the table where the decisions are made. Again, that's different than 20 years ago. I always wanted to do that, but it wasn't really realistic 20 years ago. And I want to learn and grow from new experiences. And that's consistent for me. I think that goes to the I get bored thing. So if you, and you'll get these slides, I'm sure, if you take time to really work through this for yourself, that will help guide you on what you want to do, what you like about where you are, what you like about your current role, what you'd want to see different in your current role or in a future role, what you might want to see in 5 years. People are always asking you, what do you want to do in 5 years? And you're like, I don't know. I don't know what I want to do in 5 years. Those people who are like, I'm going to be a chair or I'm going to be a whatever, good for them. I didn't have that. I was like, I don't know. But doing this helps me think about what I want no matter what the role is. So we talk about change, and I think there's often this immediate assumption that we're talking about leaving or going somewhere, but that's not what I'm talking about at all. Most of my change, 22 years, was internal. First, internal to my department, then internal to my hospital and medical school, and then internal to the organization and the institution. Sometimes, yes, it's external to an organization. And then I just put this new one, which is a new career path, because I always say, I'd love to be a florist. I have no idea what that means, but it sounds really peaceful. And it would require a big change in my life. So it's always in the back of my mind. But there are people who do completely new career paths, and you'll need somebody else to talk about that, because that has not been my experience. I guess I'm not bold enough or smart enough to do that. When you're looking at any kind of role or job change, there's a lot of different ways this can happen. You may be recruited. My chair came to me and said, I need a new co-director of the residency program, and I need someone to bring this residency program more academic with research. I need you to lead the research component of it. Okay, I'll do that. You're pursued. Somebody comes after you, is trying to recruit you. I said that one. You pursue something. You see a job. You see a role that's open in your department. I'll give you another example. There was a role for a senior clinical administrator in my department. It was over acute services or something. I can't remember now. And I went to my chair and I said, I want that. And he said, no. And I was like, what? Like, but I'd be really good at that. And he said, no, you would be good at it, but you're at this phase in your career where you really need to focus on your research if you want this kind of career in it. So that was his mentorship piece there. But I was crushed because I was like, oh, that's a job I'm really interested in. So I pursued it. I was told no. There were other jobs I pursued internally that I was told yes. But those were usually a negotiation around something. So I've had the ones where he would come to me and say, I really need you to do this. I have the ones where I'd ask, I'd be interested in something. And then this is my favorite, you design it. You see something that the department, the institution needs, and you design it. And you say, I could fill this gap, and let me tell you how I could fill this gap. And my chair would always be like, oh, Linda, really, again? And he'd say, don't ask me for money, don't ask me for time. And I'd say, okay, but I'm going to come back in 6 months and we're going to look at the outcomes, and then I'm going to ask you for money and time, right? So there was a real intentionality, and he and I had that kind of relationship where if I did see a hole and it was going to make a difference for the department, you could design something. It may be part of your FTE. This could be 10% we're talking about, or 20%, or it could be an entire change in your job. So if you're looking, and I put this together because I think it's really important that it's not that different if you're looking internally versus externally. And partly because we think internally, and this is where my lessons learned have been, is like, well, you know me, you know I do a good job. You're still interviewing for a job or trying to sell yourself for a role internally. So it may not need as much networking as if you were looking externally, but internally, you still need to be visible. You need to be effective. You need to be on people's radars so they think of you. Or if you ask for about a job that's opening, clerkship director, they've seen you be effective as a teacher. They know that you are interested in education. What I've seen many times is somebody who just wants non-clinical FTE, but they haven't done anything in this space. They're not going to get that role. There are plenty of people who have been doing work in that role and are visible who are going to get that role. So you got to figure out what you want, and not just, I want non-clinical. I want to be an educator. I want to be a researcher. I want to be whatever it happens to be, going back to those values. You want to meet with individuals in your department, whether it's your department or your medical school, whatever it happens to be, to learn about the opportunities. Where are things growing? Where are things changing? Where might there be something in the next 6 months, year, 2 years? You want people to know you're interested in growing. Often I hear from people, well, I didn't even know that job was open in my department, or no one came and asked me to apply for it. They're not going to. You need to be proactive, just like you have been your whole career. You need to let people know you're interested and find out what you need to do and what experiences you need to have that role. And that was my lesson learned in the one where I thought, hey, he'll just give me this. And he was like, no. So that was early in my career. Now I know. Just because you're great at what you do and you think people know you're doing a great job, they do, but they don't have any idea that you want to do X, Y, and Z, or what the skills and experiences you've had that lead to that. If you're asked, and I was asked many times to fill in as an interim, if you can do that, do it. It gives you visibility. You're supporting something that your chair or dean or whomever needs you to do. And you get to try out the job. I had an interim position for 6 months once. Later on, I was offered the job and I was like, no, thanks. I knew after doing it, that was not what I was interested in doing. And that was really, really important because I probably would have taken it if I hadn't had the experience. Externally, if you're looking to completely go external from your organization or even from your own department, say to the, let's say here, a university level role within the same organization, you really do need to be watching what's out there. And sometimes there are recruiters, sometimes there are recruiters for internal ones that you have to work with. Always keep your CV and your resume up to date, no matter what, internal, external, promotion. It is a pain to go back and try to update if you haven't touched it in 6 years. So keep it up to date. It's way easier and you can adapt it as needed if it's always ready. Because if there's an opportunity in the dean's office, you want your resume to take you a couple days, not a month to update because you're busy people. Similarly, internal or external, have an email drafted of what you're interested in so you can edit that as well. And then no matter what, I go back to visibility. So internal, external, it's important to be visible so people know what you're doing. I put these up here because, again, I think they're very similar. Things are sometimes posted. Things in your department or in your institution may be posted publicly, and you may be the internal candidate. So you need to approach it just as if you were an external candidate. There's maybe a recruiter, there may not. There's always issues of confidentiality. Internally, if you're the internal candidate, sometimes that's a little bit harder, but still everybody should be sticking to that. If you're doing things internally as well, and you're looking at, I'd like this 20% job over here in the dean's office, you might want to let your boss know, because that means something, if you were to get that role, is going to have to shift, and you want that person's support that you're applying for that position internally. And then you also want to know who's going to make decisions about your time. There are pros and cons internally of knowing people, knowing places. It's also, you'll hear me say multiple times, do not burn bridges, because you don't know who you're going to work for 10 years down the road, or who or what you want to do. And it's really, really important because when you're in your own organization, people know you and they know the good and the bad. I talk too much and people know that, right? So I've had to kind of work on that sometimes. If you design a job, you need stakeholder input. You need to know what is needed in the organization, not just, I would like to do this because I think it would be a great idea. You need to have a rationale for how it's going to help the organization, how it's going to help whomever you're talking to. You need to think about where the fund's going to come from. Because no matter what, just, I'd like a 20% job to do this. Great, go ahead. There's no funds for that. Where would the funds come from? How are you going to do that? Is it a grant? Is it revenue? Is it philanthropy? Where might those come from? And that's part of your rationale. And if you don't have the support of whomever your leader in it, it's not going to happen. So you want to make sure you're aligned. Takes a long time. You have to have patience because this doesn't exist and it takes time. So just to think, when I'm talking internally, externally, whatever, I just wanted to put this up. I give a talk about kind of the changes in medical schools and healthcares and the roles, and there are a lot of roles that are evolving. There are traditional roles out there, deans, CEOs, clerkship directors, program directors, those all are there. But there are all these new roles in health systems and that intersection of academic medicine that are available to you. I can't even, precision medicine, chief technology officer. I'm sure there'll be some chief AI, somebody at some point. These are opportunities for growth and for you to work with your organization to develop new things, whether it's departmentally or organizationally. So I just put this up here so you can see that we're bigger and different than maybe we used to be in terms of thinking about the roles that are available. So I'm going to talk about the 22 years just a little bit. And I put this slide together that I hope, I don't need you to look at the roles specifically, and I'm always happy to talk to anybody about any of them. But when I put this table together, it made me see the trajectory, which was, you can see early in my career when I came out of fellowship, it was departmental. I was in a department, doing a lot of work in the department, establishing myself as a clinical expert, as a researcher, and as a clinical administrator. And then it started to shift. I was more administrative and researcher, still doing some clinical. But I was asked to step in as an interim associate dean or assistant dean, can't remember what it was back then, because the person was promoted to the university level. And it was a new dean, and he asked me to do an assessment of what we needed in the space of inclusion and culture. And I came back after doing a whole assessment and said, you need a senior associate dean. This is what it should look like, yada, yada. He agreed. He did a national search. I put my hat in and I got that role. That, if you had asked me, was A, not a role I knew existed, and B, it was not, I'm going to be X, Y, and Z. It was stepping up when asked. And how did he even know to ask me? I sat on committees around diversity, gender, and equity. And that's how I got asked. So it was being visible. It was doing a good job, stepping up, doing a full assessment, and then applying for the job. And so I moved then. I was half and half for about 5 years or more. And I was senior associate dean. And it became very clear to me during my work that this needed to cut across the health system as well. It couldn't just be medical school specific. And so ultimately I was appointed vice president as well as senior associate dean. So I went from half and half to fully in the dean's office, still doing a little bit of clinical, but really in the dean's office. And that transition was a huge transition for me because the cultures are very different. And I'll talk a little bit about that. But so you can see it moved from department to medical school to health system. And then I became very involved at the university level as well. So the transition changed. And then after about 10 years, I was looking, there's a long story. I'm not a bioethics person. Why was I the inaugural director of the bioethics? It was because I was an administrator who was asked to establish that and help bring that up so they could recruit a top-notch bioethics researcher, and they have. So I was never going to do that long term. I was asked to do something, and I did it. And then I'll talk about in a minute why I left Rochester at that point. But I had spent my entire career, as you can see, being able to transition internally. And if you take nothing else away from today, I hope it is that you can do this if you're doing it intentionally. And then there is a point. So for me, the point that I left was for a lot of different reasons. I realized while I was doing the inclusion and culture work that I loved working across professions. I loved working across the continuum of education. And there was not an opportunity. And I had a conversation, and the kind of role I was looking for just didn't exist and wasn't going to exist in the near future. So I had to make a decision. Do I want to continue to kind of figure my way, or am I at a stage in my career, in my life, where I can look somewhere else? There was a lot of change. My husband and I were like, if not now, when? Our kids are grown, everybody's on their own. Let's try something different. So it's a very different life stage that I made that decision. So this was new to me. I'd never done this, right? Because for 22 years, I'd been kind of maneuvering within my own organization. So I had to figure out how to even look for a job because we were talking about it last night. When I looked for my first job out of fellowship, anyone know how I did that? I wrote a letter and signed it, put it in the mail, and it went to chairs who'd say, do you have a faculty position? And then they called me on the phone to interview me and invite me. So it's a different world. And one I didn't have a LinkedIn profile, didn't do any of that stuff because I had been doing it all internally. But I looked, I networked, I contacted search firms, and I watched. But I continued to do my job well. And if something had changed internally where the jobs that I was looking for were going to be available, I would have stayed and applied, but they just weren't at that point. But I kept doing my work and trying to evolve there. And the way I found the role I had was not online. I was networking. I talked to a colleague of mine who happened to be in Maine who said, hey, I heard about this position. Not sure if you'd be interested. You should at least look at it. And I wasn't calling him to say I was looking for a job. I was calling him around mentorship about how do I think about the next phase of my career. So again, another one of those transition points where you just never know what a conversation is going to lead you to. So this is relevant to no matter what, internal, external. What are the values of the organization? What are the roles and responsibilities? What are the expectations of the job? What is the culture? And this is really important because what I learned in Rochester was the culture is different between psychiatry and the dean's office and the health system and the university. Same organization, very different cultures. Do you want to work in those cultures? Who's your boss going to be? And in our matrixed organizations now, you want to be clear. Who's your boss going to be? Is it the chief medical officer? Is it the chair? Is it the dean? Is it the CEO? Who's going to be your actual boss? Is the location where you want to be? What's the type of living you want to be? I have porcupines in my backyard. I have learned to live in a very rural setting, very different than where I've ever lived. Love it, but it's taken some time. Is there a financial impact? Will there be opportunities for my family? What will that look like? What am I going to lose? What am I going to gain? Whole assessment. Again, if you take nothing else away, internal, external, doesn't matter what role you're looking at, ask these questions. Do I know what the job is? Not the title, not the money, but what's the role? If I'm going to be a clerkship director, what's the role? What's required of me? Do I want that job? And what am I being hired? To fix something, to build something, to dismantle something, to just take it from good to great? And what are the expectations going to be of me? And for whom do I work? So no matter what role you're taking, 10%, 20%, 50%, ask yourself these questions. For me, Maine turned out to be the right opportunity. It's the right challenge, was the right time. I was lucky. Doesn't always work out that way. I actually took this picture. This is me. And it's blue skies all the time. That's a whole nother conversation. So what I would encourage you, no matter what, when you're looking at roles, is to structure your decision-making process. Go back to your values, go back to your goals, and go back to what your criteria are. Ask people, network, lots of questions, dive deep. Beware of confirmation bias. If for some reason you're not thrilled at the moment, you're tired, you're grumpy, you're, I don't know, it's a bad day, and somebody offers you something, it's not always greener. The grass is not always greener. It's different grass. I always say it's different piles in the grass. They're in different places. There are problems everywhere. And so don't allow yourself to have confirmation bias that it's great just because it's different. Really do time to think through it. And that's where getting outside perspectives is really important. And not just your partner, and it could be your partner in clinic or your partner at home, they are invested in your answer. Ask somebody who's not invested in your decision. They will have an objective view, and hopefully they will ask you these questions and remind you of the questions you need to think through. A lot of times people don't change their jobs or their roles because they're comfortable. And comfortable is great. If you're happy and you're comfortable and there is no push, then don't change. But if you're not, you can think about it. But a lot of people, they don't know what they want to do. We say, what's your passion? My passion, like I said, I'd love to be a florist. That is not going to happen. So I don't use the passion language. It's more, what are my values? What am I interested in? What makes me happy? What do I love to think about? Where is the challenge? Sometimes we get overly attached to our job. I loved being the director of the consult service. And when my chair asked me to give that up and be the residency co-director, I did not want to do it. But he was very clear. If you want to grow, this is another opportunity to get experience. And I knew I loved being residency director. I loved my colleagues. I knew I wasn't going to be one of those 30-year folks. There are people who love residency and they'll do it for their whole career and they are phenomenal. I knew I wasn't going to be that person. I loved what I did. It was good. And then I moved on. So you may not know what you want to do, but again, going back to things, and you may also not want to change, but sometimes it's the right thing to do. Money, benefits, golden handcuffs, if you haven't heard that term. Some places, people will talk about, but if you have tenure, you're not going to ever leave. Why not? Yes, there's a lot of things that come with tenure potentially. Your benefits, but that's why you have to look at the whole picture. Don't let that be the reason. It may be one of the reasons you stay, but ask questions. The loss of identity, this is the issue for me. When I went from departmental to the dean's office, because I really gave up a lot of my clinical and my work in the department. So my identity as a psychiatrist became less and more of a medical administrator. And that was really hard. I had to make a conscious decision. And then we all have a lot of fear of failure, if you have to relocate, even if you change clinics, like from one side of town to another. Losing your colleagues, even in that, right? Who you work with on a day-to-day basis. I'm going to go lead this clinic over here in the same institution. I'm still going to lose colleagues simply because I'm not with them every day. We were just talking about in person and the differences there. New teams, and we always worry we're making a wrong decision. So all of these things, again, are relevant no matter what role. There's all kinds of other things that can really lead into your decisions and some of the challenges. And this one I just want to highlight because whether you're being recruited or you're doing the recruiting, it's important to know that women, again, this is data, this is not individuals, often won't apply for a role if they don't check the majority of the boxes. Men are more likely to apply for it with fewer of the boxes checked. And we need people to understand when you look at those roles, you don't need to be 100% in each of those boxes. Those are guidelines. And yes, there are certain things you have to required, MD or DO. Okay, that's required. You have to have that. But when it's experience in X, Y, and Z, it's important to think about where you are in that continuum. If you only have one of the 15, probably you're not ready for that role. But this data has been out there for a while, and it continues to floor me when I see really accomplished individuals who say, yeah, but that role says X, Y, and Z. Give it a try. Give it a try. It's the worst they can say, no. Transitions, again, this is just so, and again, you can have this as you think about, and there's a whole nother talk about actually transitioning roles and what you need to do. But no matter what, this is very similar, and which is why I did it. You may feel transitioning a role internally that people know you, you know the culture, you know the people, and the reality is you probably don't. It's different, and you want to make sure you're touching on all of these things and not making assumptions. And I'm not going to go into detail here, but you can have this to think about that. And so I'm just going to end with my personal lessons learned. And I hope what you heard me say is just reevaluate every few years, 4 to 5 years, especially if you're happy. Still reevaluate. Where do you want to go? What do you want to do? If you're unhappy, reevaluate earlier. What do you want to do? Go back to the why and what are you expecting out of a change? Really, really important, because sometimes what you want out of the change, you can get where you are with a little bit of a different trajectory, with a little bit of a conversation. And sometimes you can't. And am I being realistic? That's a big one. Health systems, medical schools, they're all in transition. Researchers, clinicians, educators. So it is really important to understand what different roles, different organizations, they're all going through change. And so what is it about where you are that you're thinking something different? And this is my key takeaway, right? I started here, your career is long, lots of unexpected turns and opportunities. Be open and prepared. Watch. You never know what's going to come down the pike. I love making your own opportunities. Be on the network and be on the radar. Put those two together. Always go back to your values. Your values will guide you. And apply for things. Look at things internally. Try things, but do your homework. And I am not a risk taker, but sometimes you have to take calculated risks. And you're going to make mistakes. I'll do. I've made a lot of them, and I hopefully have learned from them. If you don't learn from them, that's the problem. And I hope you have fun. So think about your future, make another picture, what you want it to look like. It could have all kinds of paths, and you may just not know which path that is yet. So I'm going to stop there. Here's the references and see if anybody, I think I have 3 minutes left. I told you I talked too much. Questions, comments?